there long-term medications that you put people on post-stroke?
Yes, yes. So if you have, for example, atrial fibrillation, which is a risk factor for stroke, then you would take a blood thinner or an aspirin, either or, to lower your risk of having a stroke. So there's things as far as the technology that we can use, the medications that we can use, and that's in constant development. So we're trying to be able to offer this medication to more people faster, safer. That's one thing. We're also looking at ways to protect the brain in some ways, to freeze it so that you can give the medication not just in 4.5 hours.
To freeze it, to stop the damage being done.
In a figurative sense. So
right.
yeah, I mean, there are some research on cooling the brain that hasn't yet panned out as we would like for heart attacks, where you have a heart attack and you can cool the brain to prevent brain damage. Not so much for stroke, but there's more research going into that area as well. But what we call neuroprotectant, so chemicals or things that you can do that will prevent irreversible injury for longer periods of time, so you have a longer time window to provide therapy. So that's one thing. The other thing that goes into systems of stroke care, so you have the ambulance, you have 911, you have dispatch, you have hospitals. How do you organize everything so that more people, if they have a stroke, have access, prompt access to a center that is able to do this?
Are there something that paramedics can do in preparing for this?
Oh yes, paramedics are vital on this, right? Because they're the ones that have to go to the call, triage it appropriately, and say, no, this is something that has to go to a center that is able to provide stroke care. And there's different levels for that. There's stroke ready, primary, and comprehensive stroke centers as well.